So how do we decide how much Botox to put in what location? In my mind, it varies a lot depending on the size of the face, the shape of the face, the strength of the muscles, the location of the muscles, and of course it's different for everybody, and the specific look that she's after. Some people really like to have their brows up high and lifted. Some are trying to correct an asymmetry, like maybe one eye is a little smaller than the other eye. Some people are more comfortable with about 50% of a reduction in their muscular strength, and others want to have it completely relaxed. I never use the P word. It's not paralyzed, it's relaxed. So if the face is really little, then I end up doing just one shot in the procerus and 2 shots in the corrugators. If the face is bigger, then I generally go with 2 shots in the procerus and 3 shots in each side of the corrugators. It makes it easier when you really feel the muscle between your thumb and forefinger, because you get a sense of how strong that muscle really is. A little bit of a warning about the forehead. I noticed that a lot of people tend to over Botox the forehead, which is kind of the kiss of death, because if you put a lot of Botox up here, then what happens is the frontalis completely relaxes. And often you'll get a brow heaviness, which is a very uncomfortable feeling for the patient, and she tends to get more headaches and feels a little more tired, and it's not a good feeling for her. So be cautious about that. Don't forget to do nasalis. That's a great little muscle that tends to get more severe over time. And if you want to do around the mouth, make sure that you ask, are you a singer or do you play a musical instrument? Because that will completely change your embouchure. The other one that does embouchure is the DAO. A lot of people can get by with just 1, 2, 3 shots around their crow's feet. But if they have really strong crow's feet, I like to go 1, 2, 3, and then another 1, 2 in between the first 3. Platysma is a good one to do. It tends to help with that turkey neck syndrome that people have where the skin gets really loose around the neck. I find it happens a lot with athletes because they're pulling hard on their neck, doing all their sit-ups and so on. And so they tend to get these bands of platysma muscle that stick out. I haven't got one, so I can't show you. But the band sticks out, and you can Botox that independently, which will decrease the folds of skin in the neck. Mentalis is used for those people who have the really tight muscle right here, and over time, you know how some people tend to develop that chin that really comes forward. If you Botox that for a while, then that tends to relax and decrease the appearance of that bended chin. You know how those people who they smile and you can really see their gums under there. There's an injection you can do on the sides of the nose that will target that problem. There are lots of things that you can do. The question is, what do you want to do? What does she want to do? What's she comfortable with? Would she rather just start out with something minimal, and then when she feels comfortable with you and she understands the Botox a little better and she's feeling a little more confident, that's the time to make a suggestion. Okay, well, given that went really well with your crow's feet, you may want to consider this. Maybe not this time, but perhaps next time you'd like to try that. Remember that most people who come in to get their Botox done or their fillers or whatever, they're feeling pretty uncomfortable about the whole situation. They're not feeling good about themselves, and the last thing in the world they want is for somebody to look right in their face and go, oh my God, what about this and this and this? And they're thinking, oh my God, get me out of here. I'm uncomfortable, I don't like it, I don't want to think about my face, I don't want to look at my face, I want to leave. On the other hand, if you make a point of meeting everybody and thinking, okay, what's the best feature about this lady? Wow, you have fantastic skin. Great. We want to focus on the positive physical attributes for a couple of reasons. One is it makes her feel better, because that's what she's there for. She wants to feel better about herself, and you can start that process just by pointing out the things that are good about her appearance. Secondly, in my mind, the whole objective of Botox and fillers is to maximize the good features. So if you've made a point of figuring out what's best about this lady's face, then you can turn your mind to, what can I do to bring those out? Her eyes are fantastic. Okay, so I can make those even better by doing a brow lift and maybe some crow's feet. Studies show that when you meet somebody for the first time, they look at your eyes and they look at your mouth. And pretty much everything else is just distraction. So for instance, if the cheeks are very flat, then that might take away from the look of the eyes and the mouth, which is why I often suggest, okay, let's do some crow's feet injections, maybe get rid of this line between your eyes. So now we got your eyes brighter. We want to frame your eyes by bringing your cheek up. And the way to do that is to put filler in the cheeks. Now your mouth is a pretty good shape, but the trouble is that with age, we've got some lines that are coming down this way. So what we may want to do is just put a little tiny bit of Botox in the upper lip. And then 2 weeks later, once the Botox has taken effect, we can use some filler to just smooth the line of the upper lip. Perhaps add a little bit of volume in the lip. And I guess this is where I'm different from some people, is that I've got kind of a minimalistic approach. I like people to look fantastic for their age. I really don't like the look of big fake lips. I'm not looking to get rid of every line and every wrinkle. We're supposed to have lines and wrinkles. There's nothing wrong with that. People think that it's going to be really expensive, but the reality is that if you can just tweak a few things on a regular basis, then I find that my patients kind of get younger and younger as time goes on, especially relative to their true age. And there's nothing more satisfying than watching a woman come in all nervous and not sure about being there, start to feel a little more comfortable, and then by the time she leaves, she's thinking, okay, yeah, there are some things that are going for me. And not only that, but there are a few things that I can do that aren't particularly expensive that are going to make me feel a lot better. And sure enough, they come back in 2 weeks and they say, yeah, like I feel better in the morning. I look in the mirror and I think, wow, maybe I'm not so old. And that has a ripple effect, because as soon as they get up feeling better about themselves, well, then they're more likely to go to the gym. They're more likely to smile at strangers, which increases their social network. It gives them that little bit of extra social confidence. And who doesn't need that? Because the reality is that we all kind of feel in some way that we're not good enough, not smart enough, not pretty enough. So it makes me feel good to give people that extra little boost and hope that they pay it forward and make somebody else feel good about themselves, even if it's just by smiling at them one day.